Okay. Hello, Mr. Cleve. How are you doing?
Hi.
So it has been 6 years.
6 years. I can't believe it's gone so quick.
Great.
And you haven't changed a bit. I have. I've got a lot more wrinkles, but you still look the same.
No. I think you are looking younger than before. Do you have your old picture in your mobile or somewhere?
No, well, I've got pictures up. Well, I don't like to look at pictures of what I was before. No, I've thrown them all away because I looked so dreadful. I didn't realise it at the time.
So you were 30 kilos up than what you are now?
Well, yes, I was 120, and what am I now? 75.
75.
75. So it's
even more than that.
Yes, 35 kilos.
Yeah, 25 plus 24,
But the important
45,
thing for me was the diabetes. That's always been the number one thing, alleviation of diabetes.
Alleviation of diabetes. Okay.
Weight, is just
how
a
would
bonus.
you put it? How is your control of diabetes?
Well,
better?
I don't consider I have diabetes anymore. I mean, doctors say, oh, you cannot be cured of diabetes. You're only in remission temporarily. It'll come back eventually. But I think they're wrong. And I know long-term studies show it's good. They still haven't done very long-term studies.
Okay. How much is your HbA1c now?
It's about 5.
About 5?
Yes.
Okay.
Which is very good when it used to be around 7.
How much was it before?
7, between 7 and 7.5.
Even before surgery? So
before surgery. So it's average. It was okay.
You were keeping good control?
Yes, because I was a newly diagnosed diabetic. I only had it for about a couple of years. It was the diabetes that pushed me to do something about it.
What the kind of patients we get here most of the times, their HbA1c is around 14.
Oh wow!
Yeah. So from 14, if it comes down to 5, then you're
amazing.
really satisfied.
Yes.
So, because that's a very
very
strong
bad.
result.
14. Yeah.
But this is what we see every day with the mini gastric bypass. The result of diabetes control is very good, and even in the long run it's very good. But there are a few cases where we had relapses also when it comes back after a certain time. So what I have seen is, do not think that we have treated the diabetes for sure, for the rest of your life. Do not take it like that.
Yeah, well, I know that, but as for me, at the moment, I consider
whatever the endocrinologists say, that also makes sense, because only God can treat diabetes completely. What we are doing is we are keeping it under control. So your diabetes is presently very well controlled, not with medications, but with mini gastric bypass. But in the long run, we do not know that maybe, say, after 10 years down the line, 12 years down the line, mini gastric bypass effect tapers off.
Well, I don't like to think of that, but it's frightening in a way that if it can come back.
If it
but
comes
at the moment, I like to be positive. I like to be positive and think.
That's fine. But let us agree to the the other version also. Let us say after 10 years, if it comes back. But even if it comes back for good 10 years, you were without diabetes.
Yes. Oh yes.
And your body has been washed. Your
and it still won't come back to the
sugar.
It'll still be better than anything
eyes
else.
And your kidneys and everywhere it has been washed away. And if it comes back, it would be a kind of new onset diabetes, and it will take 10 or 15 years more to reach that point again.
Well, by then another 10 years I'll be 70. So
I think your kidneys are safe, and all other side effects which you are going to have from diabetes.
And my liver has liver problems have gone. I had the fatty liver.
So
before.
now the liver is.
I'm having regular fibro scans. There's no stiffness in the liver.
See, all these diseases, sometimes I think that, what are the common diseases these days? Type 2 diabetes, hypertension. You had hypertension earlier?
Yes. So I was on Ramparil, 5 milligrams.
Okay, what about now? Are you taking some?
No, I'm 120 over 80. So sometimes 120 over 70, so completely normal.
So then...
cholesterol, I was 7, now I'm 5.
Okay.
Below 5, so everything, LDL, HDL, triglycerides,
everything is
all
normal.
in the normal range.
Okay, so all these common diseases, diabetes, blood pressure, cholesterol,
metabolic syndrome.
This is a metabolic syndrome, So this gets treated, or we can say it gets completely under control with the mini gastric bypass. And without much of trouble, without much of effort.
With no effort really at all.
So that is good. A mini gastric bypass controls the metabolic syndrome in a safe and sound manner.